Today is November 29th, 2018, and this is Christine. Hi, Christine.
Hello, it's good to be here.
Yeah, Christine came in approximately 7 to 8 weeks ago with a right knee injury. Christine, would you like to just share the type of problems you were having with your knee?
Yes, a lot of pain, a lot of swelling, not being able to walk very far at all, and limping badly, and really not being able to do anything. It's just basically not able to move very far. It was a lot.
What did you do to your knee? How did it get hurt?
Well, I wasn't aware of injuring my knee, but when I had the x-ray,
Dr. Sevlie, your next patient is ready.
it was showing that my patella was riding higher than it should have been, and the bone underneath the patella was damaged with bone spurs, and not that I understood any of that. All I knew was the symptoms were really terrible and very debilitating and getting worse and worse as I went along.
On a scale of 0 to 10, 10 is can't walk because of the degree of pain, 0, no pain. What level of pain were you at when you entered the office, would you say?
Probably an 8.
An 8?
Yeah.
Okay, and then what did we do, and would you like to share what your experience has been in regards to the 7 weeks of treatment?
Yes, I was living up in Grand Marais, so we had to relocate down to Minneapolis because I had to commit really to 3 or 4 days a week for 3 months for myself for this healing to take place. I was not going to have surgery, and I was not going to go the medical route. So I had to commit to that, which was easy for me because I was in so much pain and my situation was progressing and getting worse and worse. I was kind of desperate. So it was wonderful to find your place here. And I wasn't disappointed because the treatment itself is deep, it's intense, but it allowed me anyway to really engage in my own body, to really come back into my leg and my knee, which I had totally disconnected from that part of my body because of the pain. And so it was really really self-empowering for me to come back and to work with the process of my knee. It was not easy on lots of levels, but it was also very joyful to really participate in this healing in my knee. Mm-hmm. So it's been great for me.
You had difficulty with significant swelling, your range of motion and your ability to just do normal daily activities was significantly limited, correct?
Yes, it was really, and yeah, it was really bad. I was really really disabled.
And
in that.
What level of improvement would you say you've had over the past 7 to 8 weeks since we've begun the journey together?
Well, at least 70 to 80% more on the 80% level, because really I'm back to being able to really move around pain-free, no swelling, and my mobility is coming back really strongly. Yeah.
Have you been surprised by the improvement at all or not?
Well, I understand the process here of dealing with my pain in my knee, so I kind of expected it, but I'm joyful that it's happened. Maybe part of me was a little afraid it wasn't going to take place, but it's been wonderful just to experience how quickly actually the pain started to alleviate. And that wasn't 8 weeks. I think my pain started to alleviate in the first week of treatment. So that was fantastic. And the swelling disappeared very quickly also. So it was really kind of very, very good to feel the relief, and coming regularly was very good for me too, because I needed some action on my knee. I'd been suffering for some months with a misdiagnosis. So it was really wonderful to come and just see the results.
So Christine actually had what's called patella alta, according to the radiology report. The patella had actually shifted upward because of an imbalance in her quadriceps muscles firing, and as a result there had been friction that occurred under her kneecap, which then produced what is called sclerosis, or increased bone growth because of the friction, and then spurring, degenerative spurring occurring under and around the patella or the kneecap, which then with every step Christine took, the joint was irritated and inflamed, and that's where the pain was originating from. And then the second radiology report indicated that there was actually degenerative changes happening in her medial compartment where the meniscus is. So there were a variety of things that were impairing Christine's ability to move. Christine, with kind of what you've experienced and how you feel it's been going, do you have any advice for future patients?
I would strongly recommend being here because, the knee was a symptom and the causes in my quadriceps, I needed treatment, really in-depth treatment and overall treatment of my body. If I'd gone to surgery and had the knee cap just placed back in the patella, then nothing else would have been addressed. And I know it wouldn't have been successful because I desperately needed to have my whole body realigned. So I would say to everyone out there, don't hesitate to come here. I feel really touched and grateful to be here.
Christine, thank you so much. Appreciate it. You've been a joy to work with, and I can see you running in the near future. Do I have your permission, Christine, to share your story with doctors, students, or patients anywhere?
Absolutely.
Any restriction on that?
None at all.
Thank you so much, Christine. Look forward to just being more mobile than you've ever been.
Absolutely. And celebrating life, which is what we're all about here.
Thank you.
Yeah. Thank you.